Hi everyone, it's Dr. Frankie here. Welcome back to my Women's Health Wednesdays with FemFresh. This video is a juicy one. We are busting the myths around sexually transmitted infections. I see loads of myths floating around about STIs on the internet, and I thought in this video we can do a quick fire myth busting session and educate you a little bit about STIs and what you may or may not know to be true. Myth number one is you'll know if you have an STI. This is a huge myth and a really potentially dangerous one. Surprising to many is some of the most common STIs, such as chlamydia and gonorrhea, often have no symptoms, and even your doctor may not know that you have an STI just by looking at you. In the UK, the most common STI is chlamydia, and up to 70% of women testing positive for chlamydia will have no symptoms, and around 50% of men will have no symptoms. So unless you get an STI check, you may not know that you have this infection. Men are more likely than women to show symptoms of an STI. Common symptoms men may experience are things like discharge, pain on urination, pain in general, and irritation or redness of the penile skin. It's important that you get regular STI checks and use barrier contraception such as condoms until both you and your sexual partner have both had a negative test. One of the most scariest things about STIs is that untreated infections such as chlamydia can lead to something called pelvic inflammatory disease, which is another topic that we can talk about in another video. But it can be really serious, it can cause a lot of chronic pain, and it can sometimes affect fertility, and that is why it's so important to get tested and treated for common STIs such as chlamydia and gonorrhea. Myth number two, only young people get STIs. This is also a myth. Anyone who is sexually active can catch an STI, and actually, the rates of STIs in the over 65 population have been increasing over the past years. You've got to remember that contraception isn't just about preventing pregnancy. Often in the postmenopausal population who can no longer get pregnant, the rates of uptake of using contraception reduces. But remember that only barrier contraception can reduce your risk of getting an STI, and things like the pill and implant and coil, whilst excellent at reducing the likelihood of unwanted pregnancy, these ones don't protect you from sexually transmitted infections. Myth number three is that only people who sleep around get STIs. This is also a myth and a really damaging one. There is a lot of stigma surrounding STIs, and it's often seen that people who have sexually transmitted infections are promiscuous or sleep around a lot, and that's a really kind of damaging narrative. Anyone who's been sexually active can catch an STI, whether that's someone who's had sex one time or someone who's had sex 100 times. The numbers don't matter. Anyone who's sexually active is potentially at risk of catching an STI. And also, don't forget that STIs can be passed on through any type of sex, whether that be vaginal, oral or anal sex. Myth number four is that once you've treated an STI, it can never come back. This is also a myth, but it also depends on the STI. Most STIs can be cured if you treat them early. For example, chlamydia or gonorrhea can be easily treated with antibiotics, and if you treat them, they won't come back again unless you were to contract them again from another positive contact. And if you have tested positive for an STI, both you and your partner should receive treatment to avoid the possibility of reinfection. Other STIs, for example genital herpes or HIV virus, are actually with you for life, and this is because they are viruses which enter your body and then they can lay dormant in your body, and they can reappear at certain times and kind of reactivate themselves at times where you may be a little bit run down and your immune system is suppressed. The good news is that there are antiviral medications that you can take to suppress these viruses and keep them at bay, but once you caught them, they are never completely eliminated from your body. Taking the antiviral therapy is still very important to do, as it slows down the progression of the diseases and reduces your chances of passing them on to a sexual partner. Myth number five is that you can catch an STI from a toilet seat. This is a complete myth. There is no evidence that you can catch STIs from a toilet seat or from any surface. They are spread via sexual contact and exchange of bodily fluids. And the final myth is that if you have good personal hygiene, it reduces your likelihood of catching an STI. This is a myth. Again, this relates back to stigma surrounding STIs. STIs have nothing to do with personal hygiene. People who have sexually transmitted infections are not necessarily dirty. Whilst it's important to maintain good personal hygiene, it won't reduce your likelihood of contracting an STI. So takeaway messages from this: STIs are more common than you think. More people than you think have had them will have been tested positive for an STI. You should get tests regularly. You should use barrier contraception until you and your partner have both tested negative. And remember that STIs don't always show symptoms, so please get regular tests. My name is Dr. Frankie. I'm here with FemFresh, and I hope you found this video educational. If you have any questions, pop us a comment in the comment box below, and I'll see you next month on our Women's Health Wednesdays. Bye now.